We opened in October of 2012. It's a 12-bed infusion therapy center. We offer a place where patients can come to relax.
It's warm, it's caring, it's inviting. Needs are met, but then we go above just meeting the needs. When you come to somewhere and you know that you're going to be there for 5 or 6 hours getting chemotherapy, you don't realize how important a TV is. You don't realize how much of that entertainment is important.
Each patient has their own infusion chair, a TV, snacks, refreshments. They have a very calming atmosphere.
When they built this place, they did a wonderful job making it on the 3rd floor. We set up in the trees.
They can look out the window, a very expansive view. Then they get one-on-one care from our nursing staff, and they get all these complementary therapies.
Healing Touch was developed by a nurse with the intention for nurses to use it in hospital settings as a complementary therapy. It focuses on the human energy field, and when our energy field is disturbed in some way, it can lead to illnesses. And then conversely, if you are ill, your energy field will be disturbed. So you want to be in harmony with your field. Usually what we'll do with an individual is have them do a rating of, say, from 1 to 10 on how they're feeling. We usually have them just relaxed, close their eyes. I place my hands usually on their shoulders, and basically just to be in tune, their energy field and my energy field. The treatment could take anywhere from 7 minutes to an hour. You do see the progressive relaxation that occurs from the beginning of the session to the end of the session. As a therapist, my objective is for the healing of that individual, whatever that healing might be.
It's very soft strings, if you can look at it. It's much softer than the guitar.
Music therapy is the use of music as a clinical tool to help an individual reach their goals. So that could be social, spiritual, cognitive, physical, communication, and so forth. Here what we use music as is a healthy way of expressing themselves, having an outlet for relaxation, decreasing anxiety. That could be very common as a cancer patient or a patient at any hospital. We can just listen to music, we can talk about music, we can sing a song together.
It's beautiful. Again, take me home, country.
I had childhood leukemia between ages 3 and 8, so I'm a cancer survivor myself. And I also lost my mother to lung cancer 5 years ago, so I've walked the path of both patient and a grieving family member. And so music has always been a part of my life, and it made sense to support the community in their journey through cancer as well. So that is why I'm here. Active playing music in a social environment, it lights up so many different areas of the brain. It kind of keeps the machine running while we're under so many sedative drugs. So it definitely helps and complements in so many different ways. I always feel honored to be a part of someone's treatment here. I feel humbled, and I feel grateful that this is something that I get to do.
My name is Susan Patton. I'm a Reiki practitioner. It's a way of life for me. It's an old Japanese healing technique, and it's taking universal life force energy, and we learn how to channel it from our palm chakras to a preset series of positions on the patient. By the time you're done, you've channeled the energy to every vital organ and gland on the body. If you were a cancer patient, one of the beauties of it is it removes toxins from your body. After the chemo has done its work and it's ready to be released from your body, your liver has to filter all of that. So if you were a cancer patient, you would want to have it because you would re-energize the liver. I don't think I've ever had a session where the person at a bare minimum hasn't gone to sleep and just been so relaxed. When I'm here doing the Reiki, I'm doing the Reiki, and All that is allowing your body to heal, to rebalance itself. It allows you to heal faster. That's what the Reiki does. And in that fashion, it heals you.
We have Mr. Henry, who came in and couldn't walk. He was in a wheelchair. And Mr. Henry went from being a man that was overcome with pain, couldn't walk, and now he's walking with a walker. And we credit that not only from his medical therapies, but also the power of using Reiki therapy.
They're treating me for infections. It's an everyday thing, you know, pain. I lost 60 pounds in 2 months. I was ready to just end it at least 2 times. I guess I'd been in here a week or so, and she came in one morning, and we was kidding about something, and she was telling me about what she done and stuff. And I told her, I says, well, I got a leg you can have. And it was itching. I mean, it had been itching for a couple of weeks. It just couldn't stand it. And she came over and she treated me for about a half an hour or so. The itching went away. I haven't had it since. She treated me a couple times for depression. I was ready to just, wrap it up. And after she treated me, I just felt more relaxed. I don't explain it, I just accept it.
It brings me to tears sometimes. When you see people like Mr. Henry, and he's been through so much, and when you see him smile and say, oh, I can put my cast on, I don't have any more pain, that's why I do it.
It's not something we charge for when they come here and get the Reiki therapy or the healing touch therapy or the music therapy. It's just something they get if they want it. I just want patients to know that we're here for them, and what's important to them is important to us. And we want them to realize that when they come here, it's all about them.
When I heard that Mary Washington Hospital is open to music therapy and other complementary therapies, I jumped for joy, because this is the first step for this area, this community, to be supporting other forms of services.
I think that they are one of the innovators. Every day they're trying to find more ways to make it work better, to get it out to the people, to let them know that they have this additional complementary therapies available. I think that it says a lot about them.
When people get a diagnosis of cancer, it's a journey that they're having to take. It's the hardest journey that they'll take their whole life. If there's one little thing that you can do that makes the journey better, that's what we're going to do.
I just recommend it for anybody that needs it. I never knew they had places like this, but I'm glad they do. It's been the best experience for me.